This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Good morning, everybody. So, Medical Minute on an interesting study that came out recently that could, at some point, change the way we do some things around here. So, the study was looking at basically management of refractory VFib and whether ECMO is beneficial. So, there's been some observational trials that looked at this, and there was some suggestion that maybe ECMO was beneficial, but there haven't been any, randomized trials to look at this until recently. So this trial, which was done in Minnesota, looked at patients with refractory VFib. So 3 shocks and still in VFib, and randomized them to either go to the emergency department, get typical resuscitation and see what happens, or go straight to the cath lab where they get put on ECMO, and then while they're on ECMO, they get a cath and see if they need to be stented. They plan to enroll 150 patients to see if there was benefit to this. And interestingly, after only 30 patients, 15 in each arm, the kind of safety monitoring board, which is at the NIH, stopped the trial early because they thought there was such a benefit. So the results were that in the 15 patients who got ECMO, 6 survived. 3 of them had good neurologic outcome, I think at 6 months, whereas in the traditional non-ECMO arm, only 1 patient survived, and they didn't even survive at 6 months, so they obviously did not have a good neurologic outcome. What's interesting is that to stop a trial after only 15 patients in each arm with only 6 successes, and then to the NIH to say this is enough data for us to say that this works for such a, aggressive, expensive intervention as ECMO, that now, can you do another study now that the NIH has said, all right, we've seen enough, we don't need to study this anymore. So it was interesting to see. I mean, it's a huge undertaking to say, all right, everyone who has refractory VFib should get put on immediate ECMO. It's a big change for a lot of centers, so I'm not sure what will happen. Hopefully there'll be some more studies to see if this works in the real world. But the trial was called the ARREST trial. It's a good name. And, you might hear more about it, might hear more about ECMO getting, tried for patients in refractory VFib, more, situations where ECMO could be helpful. We'll see if we can get some of that going. Thanks, guys.
Thank you. The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.